Hi there, you're welcome to DamiRx Care channel where we talk about medications and how to use them properly. Today we're going to be talking about one of my favorite medication, which is Omeprazole. Omeprazole is a medication that's used for heartburn. It's used for ulcer as well as GERD, esophagitis, as well as gastric bleeding, which is also known as stomach bleeding. Ouch, I know, right? So this medication is used to treat those patients in order to kind of reduce the acid level in their stomach to prevent this from causing other condition in the patient. And also patients, we use this in ulcer as well because of that acid level that medication decreases. So what dose are patients usually on when it comes to omeprazole? So patients will usually be on a 20 milligram to 40 milligram dose of omeprazole, and usually they'll take that once a day. So this medication is usually taken once a day, and it's taken right before meals. So it's taken about 30 to 1 hour before you take your morning meal in order for the medication to kind of kick in first before you take that food in order to help suppress that acid level. All right, so what are some of the side effects of omeprazole? Some side effects of omeprazole include stomach pain as well as diarrhea. It can also cause nausea and vomiting in some patients, so you want to make sure that you're aware of this. That way, if you are having these symptoms, you can kind of slow things down and just take other medication that would help with that nausea and vomiting. Also, in patients, this medication can cause gas. So patient may notice that they're, farting while on this medication. There's usually no cause of alarm. It usually goes away after a couple of days or so of taking that medication. Also, the medication can cause headache or dizziness in some patients as well. Keep in mind that this side effect is subjective and it doesn't happen to everyone. Just in case if it does, these are just some side effects to look out for that may directly be a cause from the medication. What are some other serious side effects that you want to know while you're taking this medication? Some other serious side effects include bloody diarrhea. So this is an alarming side effect that you want to make sure that you let your doctor know immediately you start noticing this signs and symptoms. That way they can help diagnose and see what's actually going on. Also, another common serious side effect of this medication is pancreatitis. So if you start noticing an abnormal left side pain in your abdominal area, then you need to make sure you let your doctor know. Also, some patients may have a serious allergic reaction to this medication. If you start noticing any chest tightness, any skin reactions such as skin rash, there's also a serious side effect known as SJS, which is the Stevens-Johnson syndrome, which is usually like a side effect that occur when patients' skin start burning. And that is a serious allergic side effect from the medication, and you want to make sure you're alerting your doctor right away. So what are some things that you need to know about omeprazole before taking it and also while taking it? So one of the things you need to know about this medication is that you want to swallow the capsule as a whole. This is a capsule that you don't want to crush, chew the tablet. So this is a tablet that you want to make sure you swallow the tablet as a whole with a glass of water. Also, you want to make sure that if you cannot swallow the capsule as a whole, make sure you're emptying the content of the capsule inside an applesauce and swallowing that applesauce immediately. You don't want to keep that applesauce in that medication in the applesauce for a longer period of time. And what else should you know about this medication? As I mentioned earlier, this is a medication that you want to take about 30 minutes to 1 hour first thing in the morning before you take in any meal. That way the medication can kind of kick in and you can also obtain the full effectiveness of this medication when you take it first thing in the morning before any meals. Well, I hope I was able to help you in terms of side effects and what to look out for while you're taking this medication. If you have any questions or concerns regarding the medication, be sure to reach out to us through our website at www.damiRxcare.com. Don't forget to hit the like and subscribe button down below if you did enjoy this video in order to also help support our community here at DamiRx Care. Thank you so much and have a blessed day.